I just want to thank the families, the advocates and the children in the gallery taking their time out to fight for what just should be healthcare. You should just get the healthcare that you need in this country. You shouldn't be on long waiting lists. You shouldn't be waiting over a year to get just healthcare. It is a national scandal that we're here tonight, we've been here before, that children with scoliosis are being failed in such a brutal, inhumane way by this state. Every day, every week, every month that goes by with children on waiting lists for necessary operations, conditions getting worse, in more and more discomfort and pain, and heading towards a point of not being operational. Like, that is an absolute scandal. I got many different emails from parents. I want to quote one, just to give a picture of what that looks like as parents, as a family. On a personal note, our own son is waiting for scoliosis surgery and was due to have it back in August 2022. We have had to blue light him by ambulance multiple times now because he couldn't breathe and his oxygen levels were dangerously low. He had his first case of pneumonia at only 2 years of age, and he's even ended up in ICU because his breathing was so bad. His ribs are quite literally crushing his lungs thanks to his scoliosis, and yet he is sat on a wait list and is having zero monitoring of his condition. That is just an undefensible scandal to have happening, not once, but multiple times in our country. The Minister didn't really attempt to defend it, which is fair enough. I agree it is indefensible. But it is by political choices that we have got to this point. That is undeniable. It is political choices that have resulted in us not providing adequate, necessary care for these children. And different political choices need to be made. They could begin to be made this week in terms of passing the motion from Sinn Féin. Part of that is establishing the task force, is making sure that the advocacy groups, that the parents, that those affected are fully involved, and then investing the resources to actually deal with this, to get through the waiting lists and to ensure that they do not build up once again. There obviously is a context to this, which is the revelations a number of months ago, where you had a group of people badly failed by the state, more than 100 children then on waiting lists for over a year, neglected, not listened to, and then you have these really shocking revelations indicating that some of their children had standards of care that were substantially less than what they should be expecting. Where you have high complication rates relating to a particular surgeon, high reinfection rates, and the insertion of unlicensed metal springs. All of that potentially relates to individual behaviour of an individual consultant or an individual surgeon. That's true. But there are institutional issues there. I mean, the very fact of how this could have happened, how, for example, springs could have been brought in to operating theatres, could have been inserted inside children, how that could have happened speaks to wider institutional, cultural issues, governance issues within CHI, but also the response to this. So the fact that the advocacy groups did not have confidence in CHI's response in terms of the second external review, which was established, spoke to the deep distrust, understandably, that these families have of CHI. But even, and there's clearly suggestions that there are children waiting longer as a consequence of that surgeon not performing surgeries. If that is the case, that also speaks to an incredible institutional failure, to be so reliant on one individual to do these surgeries. So even if you didn't have these very serious allegations and a suspension of surgery, he could have an accident. He could be sick. Many things. You shouldn't have a system based around the fact that only one person can do these very, very complex cases. All of those things need to be addressed and are part of the things which a task force should do. I do have questions over what is happening in terms of the investigation into those springs, for example, into the high complication rates. I wonder whether just very simple things have been done by either HSE or CHI. Have these springs been purchased? Have they been tested in terms of whether they are safe to be in a human body for an extended period of time? What happens if they're in a human body for an extended period of time? I hope that the HSE or CHI or working together are addressing some of those things. I also wanted to raise, I've had a few PQs back and forth with the Minister. A former patient of this surgeon has contacted me with concerns about her treatment. She was an adult in Kappa Hospital and asking about her treatment and whether that would be included in this investigation. The answer from the PQs is no. But if there is a question mark over the standard of surgery provided by one surgeon, why would we assume that that only applies to children in their care? Why would it not involve others? So I do think, even if it obviously isn't being included in this external review, but there are issues there that the Minister needs to return to. The bottom line, I just reiterate the point, political choices have led us to this point. Different political choices need to be made. We need a task force. We need action. None of this needs to be the way it is. Children do not have to be sitting in waiting lists of positions of torture for extended periods of time.